Hi there, Mark Jabin here, Medical Director for the Haywood County Health Department. And let's talk about this pandemic. Time once again for the weekly update. So we're now about a week past gatherings for Easter holiday, and as cases climb around the country, let's see what's happening here at home. So please share this with somebody you care about. You can see now red spreading across the upper Midwest, Colorado, North Texas, as well as the Southeast and Florida. The U.S. there remains 12 states in the red, and last week there were 12 states also in the yellow. This week that's down to 8. And across the country last week, 45 states had flat or rising case counts. This week that's 36. Our neighbor states, it's a mixed bag with Tennessee up slightly, and note the red in the northeastern corner. Georgia and South Carolina down slightly. But note South Carolina counties adjacent to western North Carolina have been for several weeks and continue in the red. For North Carolina, the curve looks flat, but you can see cases and hospitalizations are up. As well, there are 9 counties in the state in red on this map. There were 12 last week. And 29 in the yellow last week, down to 22 this week, so more counties moving up into the orange. In western North Carolina, all but Cherokee County and Swain have had increases this past week. Cherokee County down out of the red into the orange, but Madison up in the red, and in the past 2 days since this map was compiled, Transylvania has also moved back up into the red. Jackson has moved back into the orange, and Haywood, Macon, Buncombe, and Henderson remain in the orange, but each with significant increases, and two counties in the orange flirting with red status. Testing, again below 5% is the aim. The big move this week here in Haywood County, where we jumped up to nearly 9% test positivity rate. Jackson is also now above the 5% threshold, as is Cherokee County, and Macon has remained above that threshold for some time now. As of Friday, Haywood County, total number of cases for the pandemic, 4,126. That's an increase of 70 over the last week. And you can see the weekly change curve reflects these increasing cases. But here's the important part. Half of that total in Haywood County, just in the last 2 days of this week. And it does not include reporting from this weekend. Deaths, none new officially this week. The number remains at 95 for the pandemic in Haywood County. And at Haywood Regional Medical Center, they have averaged 6 to 8 COVID-related admissions this week, which has been roughly twice what they had been seeing before that. So, what we see across the country is a mixed picture. Some places flat or even going down, and others increasing. But it does appear a week out from Easter, we are just now seeing the beginning of cases increasing. As would be expected given the incubation period of 2 to 14 days, with the average being around 5 to 7 days. And remember, our increases started actually before the Easter holiday, so this is a ramp up on top of that. And we've not yet seen the effect from spring break. So cases are going up, and it's likely going to be May before we truly know where this is taking us. Roughly a third of Haywood County has had at least one vaccine dose, and about 20% are fully vaccinated. The best estimate for herd immunity, however, will take around 80% fully vaccinated. So we are getting closer. But please, do not forget, even those fully vaccinated can still get COVID. Yes, the chances are much, much lower. And the chance of getting really sick or dying is much, much lower. And the chance to spread it to others if you get infected is much, much lower. But it's not zero. In a study from Michigan, which has had a big ramp up in cases recently, out of all the many thousands fully vaccinated, 246 have tested positive. 11 got sick enough to be hospitalized, and 3 died. So please, if you get suggestive symptoms, even what seems like allergy symptoms, isolate from those around you and get tested. Inform those who've been around you in the previous 2 days to when you got sick, so they can quarantine and get tested at day 5 or 7 to see if they're positive. Vaccines prevent infections. Avoiding crowds, distancing, limiting your time around others, face coverings, and good hand hygiene all can prevent infections. But to tamp down cases when they're here and in your home, it will take each of us who gets sick to isolate, each of us who gets exposed to quarantine. Taking that responsibility, that's what will protect those you care about. especially if they have high-risk health conditions. So be well and be careful, especially right now.